We have a 62-year-old patient with hypertension, hyperlipidemia, diabetes, and vascular dementia who is brought in by family due to inability to care for the patient at home. He has a VA pension, receives Social Security, and is 100% service connected. And the only reason you know that is because you actually looked at the chart carefully when you admitted them. He makes $3,600 a month. The patient is ambulatory and does not require assist with transfers. He needs help with taking his medications. Given his situation, where is the best disposition option? A CNH, which is a community nursing home, an RCFE, a GPD, or the domiciliary. So go ahead and take 10 seconds and decide on what you think the correct answer is here. All right. The answer here is an RCFE. We're going to go over what that is. So let's go over levels of care. And so this was a slide from last week, actually, just so happens. I did them back to back. We did CNH last week. And so an ICU is the highest level of care. We have something called an LTAC, a long-term acute care facility. Then you have a step-down unit. We have one in Santa Monica. Then you have med-surg with telemetry. Then you have med-surg. They're technically the same level of care, but there can be nuance. You can have a nursing home, and then you can have an RCFE. So an RCFE is a residential care facility for the elderly. And there are two main subtypes, which is a board and care or assisted living facility. I think as a physician, the only nuance you need to know is that they're identical. There are tiny differences, but they're not relevant to us necessarily. Watch me eat my own words later on. Things that are really important is that they do not take insurance. They only accept money, and they can sometimes accommodate PT and OT at the RCFE. You need at least $1,000 per month. So you should check with your social worker depending to figure out the typical cost. I will say, given our economy, inflation, and the fact that we live in Los Angeles, this number is already a lot higher. And there are two main types. So similar to how nursing homes have secured, non-secured, and WanderGuard, RCFEs can be secured or non-secured. Secured is even more expensive. So we're talking about $5,000 to $6,000 a month sometimes. It's often called a memory care boarding care. I think it's a nicer way of phrasing it. And they can take care of patients who have dementia and who are ambulatory. RCFEs do not provide skilled needs. So that's what nursing homes are for. So if you forgot what Medicare defines as skilled needs, well, there's a fast facts for that. This is a very short one, but this is, again, residential care facilities for the elderly, RCFEs. And so when you think about what they are, there's two main types: a board and care and assisted living facility. So if you hear these terms used, now you understand what they mean. They can be non-secured or secured, and the secured ones are the memory care facilities. And they require money, so insurance is not accepted. And so although they don't cover skilled needs, they do help with certain things. So adaptive equipment may be available. Meals are provided daily. Housekeeping services are provided. Help with medications is also provided. And rarely, Foley catheter care is accommodated. And so the reason it's important to know all of these things is that when you do your assessment of your patient, ask them about their ability to cook meals, ability to do things around the house, ability to take their medications on their own, and what sort of structure they have in their bathroom to help them shower, etc. And that's it. Nice and short.